vote, and I appreciate Senator McConnell doing that because there's no need to interrupt hearings that we've prepared for to have a vote unless it's necessary. This morning we're having a hearing about the Zika virus to help Congress and the public gain a better understanding of the virus, as well as carefully assess what we can do to prevent its appeal in South and Central America and how much of a concern this will be here in the United States. Senator Murray and I each will have an opening statement, then we'll introduce our panel of witnesses. After our witness testimony, senators will each have 5 minutes of questions. Earlier this month, Senator McConnell hosted a briefing on the Zika virus with Secretary Burwell. 2 weeks ago, the Senate Appropriations, Labor, Health, and Human Services and Education Committee held a hearing with Dr. Frieden and Dr. Fauci. I guess that's the committee that Senator Murray is the ranking member of. So this is the third opportunity that some of us have had to hear more about the virus. And I thank the witnesses for keeping Congress and the public informed. I hear a lot about it when I go home, and I'm going to be asking some questions today, which are the questions that are asked me by family members and friends. There are a lot of questions. Let me run through a little of what we know. This virus was discovered in 1947. Until recently, it was only thought to cause mild symptoms, including fever, rash, joint pain that lasts for about a week. Only 1 in 5 people infected actually experience any symptoms. This is what we've been told. Zika is spread mostly by the bite of an infected mosquito of the Aedes species. This is the same mosquito that spreads dengue fever and chikungunya. The virus can be spread from a pregnant woman to her unborn child. It can also be sexually transmitted. And I want to ask more about that today because there's some new information about that, I understand. Zika has been showing up in numerous South and Central American countries, including Colombia, Mexico, Costa Rica, Puerto Rico, and the U.S. Virgin Islands. Last year, after an outbreak of Zika, Brazil reported a sharp increase in the number of reported cases of a rare birth defect called microcephaly in areas affected by the Zika virus outbreak. Babies born with microcephaly have smaller heads and often have underdeveloped brains. It is a lifetime condition that can range from mild to severe, and treatment varies for that reason. Today, there are over 4,000 reported cases of microcephaly in Brazil. More than 500 of these have been confirmed. In 2014, 147 cases of microcephaly were reported in Brazil. In conjunction with an outbreak of the Zika virus in additional 5 countries, French Polynesia, El Salvador, Venezuela, Colombia, and Suriname have reported an increase in the incidence of cases of microcephaly and or Guillain-Barré syndrome, a syndrome that attacks the nerves and causes temporary paralysis. Today, there are no reported cases of anyone being infected by a mosquito with Zika in the United States, or at least that's the information we have. There are 82 travel-related cases in the United States, including 1 in Tennessee, in which individuals become infected with Zika after traveling to an area where Zika is spreading. The Centers for Disease Control and Prevention also announced yesterday that CDC and state public health departments are investigating 14 new reports of possible sexual transmission of Zika in the United States. Currently, there is not a vaccine or an approved treatment for Zika. We'll want to talk more about that in this hearing. There's also no commercially available diagnostic to test for Zika, although the CDC and some public health laboratories can test to determine if a patient has the Zika virus. We'll want to talk also about the development of diagnostic tests. CDC is working to produce and distribute over 1 million diagnostic tests. Today I'll be asking about the link between the Zika virus, microcephaly, and also about how the virus affects young children. I asked Dr. Frieden at a hearing earlier this morning how long a woman becomes sick with Zika or travels to a country with Zika should wait before trying to get pregnant. I'd like to ask that question again today. I'll be asking if there's any update on what we were told earlier. I'll also be interested in hearing about the progress on vaccines, diagnostic tests, Dr. Fauci said in previous testimony it might take 12 to 15 months to develop a vaccine. The World Health Organization has turned its attention to controlling mosquitoes. More than 200 soldiers in Brazil are being deployed to help eliminate standing water. The WHO reports that mosquito larvae have been found in plates under potted plants, bird baths, and dog bowls. Mosquito control is generally a state and local issue. I'm interested in hearing how CDC is working with these partners to support efforts to control mosquito populations in the United States. There's also been some discussion about the use of genetically modified mosquitoes. I'd like to hear how realistic that is and what the issues are with that. I want to thank the witnesses for being here. This is an issue that has the attention of millions of Americans, and hopefully in this hearing today we can provide some accurate information so that we take the risk of the Zika virus in the United States seriously, but that we don't overreact to it at the same time. Senator Murray.